Time for our weekly visit with Dr. Kevin Cavanaugh. Dr. K is a retired physician, founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
Normally, we would start with COVID because that is a story that won't go away. 2.5 years and counting. But this morning, the monkeypox outbreak was deemed a global public health emergency by the World Health Organization. January 23rd, data from the U.S. Centers for Disease Control and Prevention show that approximately 2,800 monkeypox cases are currently suspected or confirmed in 44 states. Washington, D.C. and Puerto Rico, over 16,500 cases have been documented across 74 countries globally. Now, you have said before, this isn't like COVID, but it is something to at least keep on our radar, right?
That's correct, and it really is starting to become pretty concerning. We've again dropped the ball on aggressive public health interventions such as ring vaccinations, aggressive case tracking, getting individuals identified and isolated. And because of this pandemic is getting out of control. I think that's pretty disturbing. In other words, we dropped the ball twice. Cases right now in the United States are increasing exponentially, and they are driven right now by one particular group, and that's that group of individuals that's having men having sex with men. And it may well spill over to the population in general. Right now, Kentucky has had 4 cases. All of these were associated with MSM activities. Nationally, I have seen that up to 98% of individuals are within this group. And so it is right now very containable. But monkeypox has the potential of infecting everyone. So we do need to try to get this contained. It also has the potential of entering animal hosts such as rats. And if this were to happen in the United States, we would absolutely never get rid of this because it would be residing in rats and then periodically reinfecting the population. So this is a problem. Now, on the upside, we have vaccines to prevent it. There's a relatively long incubation period, so you can even get a vaccine post-exposure, which is why ring vaccination is so important. And there's also viral therapeutics such as TPOXX, which can be used. So this isn't as dangerous as COVID-19, but certainly is very concerning. And if you are immunocompromised or if you have some sort of significant health issue, this can also be a deadly type of infection. In Africa, there are 2 strains. And luckily, we have the strain which is less deadly than the one in Central Africa. So I guess there are some bright lights associated with this outbreak, but right now, we really do need to get our act together, get cases diagnosed, start being responsible with how we live, and above all, we need to get this under control because it is increasing exponentially.
President Biden's COVID-19 infection, according to his doctor, is likely the BA.5 variant, which you mentioned last week when we had you on. On Saturday, Dr. O'Connor said that the president's symptoms continue to improve, remains isolated, continues treatment. He's been double vaccinated and double boosted and is taking Paxlovid. Apparently, if you get COVID and get the Paxlovid within 5 days, it really does make a huge difference.
That's correct. And people need to do that. If you're over 50 or if you are immunocompromised or at high risk, you need to get Paxlovid because this virus is still very dangerous. You will hear a lot of people saying, oh, COVID is getting less severe. Well, that's not because the virus is necessarily getting any more milder. It's because people's immunities are slowly starting to take hold and we have therapeutics. But if you're not vaccinated and you don't take advantage of Paxlovid, you may well be a sitting duck. You don't want to become a statistic. Hospitalizations are on the rise in Kentucky, so are ICU admissions. Hospitalizations, I believe, are up 45% over 2 weeks, and ICU admissions 60% over 2 weeks. And so we really do need to take this virus seriously. Get yourself vaccinated and boosted so you're up to date and you have your immunity as strong as possible. That's extremely important.
And one other thing we need to talk about this morning is the United States just had its first case of polio since 2005.
That's correct. And that unfortunately was in an unvaccinated individual. If you look at the statistics, polio actually is somewhat similar to Omicron in that it has a very large number of mild cases, even asymptomatic cases. And in general, polio, people will say, well, it's just the flu, but it's still polio. And there are a segment of the population, unfortunately, children, that can become very sick and debilitating with lifelong paralysis. This individual was unvaccinated, and that's what we're beginning to see now is that the vaccine hesitancy with SARS-CoV-2 and COVID-19 is starting to spill over into other diseases, and these diseases are starting to reemerge. If we do not adopt public health strategies and act as a community rather than individuals, I'm fearful that we'll start seeing a reemergence of many of these types of illnesses, and it will put everybody at risk, especially those that are immunocompromised or have severe or significant health issues. So, Jack, we need to get vaccinated, keep vaccinations for all infections up to date. Vaccines have been around for decades, and they are really one of the key silver linings to medicine. I mean, they have functioned better than almost any type of intervention and strategy medicine has had. They are really a godsend. We really do need to get people vaccinated.
And if people want more information about HealthWatch USA, is that healthwatchusa.com?
healthwatchusa.org, and also on our conference at healthconference.org. We have just a dynamite conference with world-renowned presenters that is going to take place on September 14th of this year, and that's over the webinar, and it is free. So go on and register.
healthwatchusa.org. As always, thank you, sir, Dr. Kevin Cavanaugh.
All right. Thank you, Jack.